Have you ever considered what makes the biggest difference in your recovery after a surgical procedure? It is not just the skill of your surgeon or the procedure itself. There is a critical step you take every day that profoundly shapes your healing journey. Proper incision care is absolutely crucial after surgery because it directly impacts your healing, prevents serious complications, and ultimately shapes your final aesthetic result. It is your active, daily role in ensuring a smooth and successful recovery, setting the stage for the best possible outcome. The incision site is essentially an open gateway into your body. If not meticulously cared for, it becomes highly vulnerable to external threats. Bacteria can easily enter this pathway, leading to serious infections that can delay healing, requiring further medical intervention, and even become life-threatening. Your body initiates a complex biological repair process immediately after surgery, starting with an inflammatory phase to clear debris, followed by proliferation where new tissue forms through collagen synthesis, and finally remodeling where the scar strengthens and matures. Poor incision care severely disrupts this delicate cascade. Factors like adequate nutrition, consistent hydration, avoiding smoking, and strictly refraining from any activities that cause strain or tension on the incision all play a vital role in how effectively the wound closes and strengthens. A well-cared-for incision heals faster, significantly reduces the risk of complications like wound separation, and ultimately results in a much less noticeable, smoother scar. This means consistently keeping the area clean, dry, and protected exactly as your surgeon or medical team instructs. You will typically be advised on how and when to gently clean the incision, perhaps with mild soap and water or a specific antiseptic solution. Avoid applying harsh chemicals, vigorously scrubbing the site, or using unapproved creams or home remedies that could irritate the delicate healing tissue. Meticulous dressing changes, performed with clean hands or sterile gloves, are paramount to maintaining a sterile environment. Always listen to your body, and strictly refrain from any strenuous activities that could pull, stretch, or put undue pressure on the incision, especially during the crucial initial weeks of healing. Understanding the intricate biology behind wound healing, from the initial inflammatory phase that cleanses the site to the long-term remodeling of scar tissue that can take months or even years, truly helps you appreciate why consistent and diligent care is so important. Ignoring post-operative instructions can unfortunately lead to significant issues like dehiscence, which is when the wound edges separate and requiring additional treatment, or the development of hypertrophic or keloid scarring, which are thick, raised, and often discolored scars that are more difficult to manage. Meticulous care supports your body's innate healing cascade and guides it towards the best possible aesthetic and functional outcome. By embracing this focused and consistent approach to incision care, you are not merely following a list of instructions. You are actively investing in your body's remarkable resilience and its inherent ability to heal beautifully. This commitment ensures a far smoother recovery journey, significantly minimizes potential risks and setbacks, and ultimately leads to the optimal result for both your immediate health and your desired long-term appearance.